Thanks.
Okay, thank you, Dinshaw.
Okay. Thanks, Dinshaw. Thanks, Dev. Very nice show. So I'm showing you the two cases. One is the horizontal tear. Another case is a complex bucket handle tear. So this is a patient, same like Dinshaw. He is the middle-aged patient, 45, and he has a meniscus tear, no, 40 years, horizontal tear, and a big meniscal cyst. So this is a common situation we found. The patient have chronic horizontal cleavage tear. They especially they will have the joint line pain, and sometimes they have meniscal cyst that produce pain. So this patient have done this surgery last year. At that time, we didn't have novel stitch. So I did the same way like Dinshaw. We did decompress the cyst and then we repair the meniscus like using fast fix. I found that this technique is quite nice, but anyway, I found that using these techniques, I always deform my meniscus. You look at the pictures, you repair the meniscus to the capsule, right? And you make the meniscus from wedge shape to be round. So if you do this way, sometimes you may create the meniscus extrusion because you repair it to the capsule. Okay. So like this patient, also after the repair, you see that the meniscus coverage on the tibia is less. Okay, both patients because you deform the meniscus. So I agree with Dave and Dinshaw that novel stitch can solve this problem because you don't need to repair it to the capsule. You just repair the meniscus to the meniscus. So this one patient had the lateral meniscus tear and there's a horizontal cleavage tear. I make a transpatellar tendon portal and use the novel stitch to get in. And this area, you see that it's very close to your popliteus. It's just behind. So if you use the fast fix or you fix the meniscus to the capsule, it's quite risky because you can damage your popliteus and also this area really close to the vessels, right? So we use the novel stitch. Okay. And the first bite, make sure that the lower jaw, you see that? You need to see the lower jaw because sometimes the meniscus tear, the upper limb and lower limb is not equal. Okay, you make sure that the lower jaw catch the meniscus. Okay, catch the first stitch. Okay, and the second one, I prefer to go a little bit next to. Okay, make sure that I didn't make it deform, so I make it 2 bite like that way. Okay, and repair this meniscus back. Okay, so that is the horizontal cleavage tear. So this patient is a bucket handle tear. I just repaired last week. So anyway, I still use the fast fix. Okay, because in this situation, like Dinshaw say, it's not easy to use a novel stitch because the tone is very close to the capsule, right? So there's still some rooms for the fast fix. Okay, after the termination, you see that there's a bucket handle together with the radial tear. So after I fix the meniscus to the capsule, then we use the novel stitch. So this one, I use like a Mason Allen's because we have the vertical repair, right? So the trick is I put this suture just next to the green suture. So this will block the meniscus from the suture from cutting through. You see that? And then we make another bite. So this act like the stopper. Okay, and then we make a side-to-side repair. This is complex tear. Okay, so this is circumferential repair, and then we go to the next bite. This bite is the longitudinal tear, but we have enough tissue. Okay, for the meniscus tear that's not close to the capsule. Okay, like a red white tear like this, I still have some room for the novel stitch. You see that? But for the ram lesion, I think it's impossible. So for lamb, like Dinshan question, I never do this for ram lesion because it's very close to the capsule. We have no space for the nervous stitch. So this is my two cases presentation for the nervous stitch. And look at this. The benefit of novel stitch is that you can use only one novel stitch. But if you use the fast fix for the longitudinal tear, you need two fast fix, one on the top, right? Another one for the under surface. Because if you just repair for upper surface, the under surface will be open and you have problem with the healing, right? So this novel stitch one shot equal to fast fix two shot, okay, from the longitudinal tear. And you can see that sometimes if you do repair the meniscus this way, you may deform the meniscus, yeah, and loss of the conformities. Okay, thank you.